Hello, welcome to Med School. Let's continue the ECG Q&A series. This is ECG question number 3. The question is, a 30-year-old male patient brought to the casualty with complaint of recurring seizure followed by being unconscious since last 20 minutes. Patient was on treatment with tricyclic antidepressant since 2 years. On examination, saturation was 90% at room air, BP is 70/50. The ECG is on the screen. Explain the ECG and make your diagnosis. The interpretation of ECG. In the ECG, there is broad complex tachycardia and the rate is around 130 beats per minute. The rhythm is likely sinus tachycardia, and note that there is camel hump appearance in the T wave including a hidden P wave. Explain that there is sinus tachycardia with first degree AV block. The P wave hidden in the T wave best can be seen in V1 and V2. Next, there is interventricular conduction delay, means QRS duration is more than 100 milliseconds. Although it's not typical LBBB or RBBB morphology seen in lead second. Right axis deviation as there is secondary R wave in AVR which is more than 3 mm, or we can say a terminal R wave means positive R wave which is more than 3 mm in AVR, and the RS ratio is more than 0.7. These are the finding of this ECG. So what is the diagnosis? See, our diagnosis should be based on the clinical presentation and associated investigation finding. So our patient is a known case of seizure disorder presented with history of recurrent seizures and hypotension. With the combination of ECG finding, the QRS broadening means more than 100 millisecond, R wave in AVR more than 3 mm. The sinus tachycardia may be due to anticholinergic effect of TCA. So these finding is highly suggestive of poisoning with a sodium channel blocker agent, that is tricyclic antidepressant. So the golden ECG features of sodium channel blockade is patient with tricyclic overdose will also usually demonstrate sinus tachycardia secondary to muscarinic M1 receptor blockade. Number 2 is a QRS duration more than 100 milliseconds is predictive of seizures. A QRS duration more than 160 milliseconds is predictive of cardiotoxicity and will cause ventricular tachycardia. So the sodium channel blockade medications are tricyclic antidepressants, most common, type 1A antiarrhythmic, type 1C antiarrhythmic, local anaesthetics, antimalarial drugs, Propranolol, Carbamazepine and Quinine.